You can't own two pennies to rub together in Mississippi and qualify for Medicaid, and I would submit to you that is deliberately done.
Right.
Is there anything as it stands within the legislation that would, and maybe it's the fact that you're talking about this 3 years of fully funding, that would make hostile state governments more likely to extend coverage to their low and no income populations?
Well, we're going to have a situation where states aren't going to have a choice. They are going to have to expand Medicaid to these new people. We're going to have to work hard to make sure that the benefits and the procedures are in place to make it work better. But there are things implicit in the law, like no more asset tests, for example. That's one hoop that a lot of low-income families have to jump through right now.
Wow.
And that's being eliminated entirely. No more asset tests in Medicaid, save for a few small populations within the disability and senior community, by virtue of their eligibility for other programs that require that. But
because families that desperately need it can be excluded for the ownership of a
car.
Rusty old vehicle.
Right.
Home ownership, which the rest of our society seems to put a premium on, is a bar to Medicaid health care. I would say in most jurisdictions, if not all.
Right.
You're telling me that goes by the board?
That goes by the board. That's no longer.
And is that and when we say by the board, is that also across the board?
It is. Asset tests would no longer be permitted for determining eligibility for Medicaid.
God, that's almost like getting rid of the literacy test in voting in the South.
It's a big deal.